Hey there, are you worried that your child has fever, coughing, having trouble breathing, that your child might have pneumonia? Or your child is diagnosed by pneumonia and you want more information about it? Well, before anything else, I'm Dr. Kristine Alba Kiat. I'm a board certified pediatrician, and my mission is to empower you, moms and dads, so you can raise happy and healthy kids. In today's Ask Me Anything episode, I will answer your 10 most common questions about pneumonia in kids. So let's get right to it. First question: what is pneumonia in children? Well, pneumonia is basically an infection that leads to inflammation of the lungs, causing symptoms such as coughing, fever, and difficulty of breathing. What causes pneumonia in children? Well, pneumonia is most often caused by infection. It might be from viruses, bacteria, or fungal infection. The most common is still viral pneumonia in kids, and the most common culprits of viral pneumonia in children are influenza or the flu and RSV or the respiratory syncytial virus. Bacterial pneumonia as a cause would depend on the child's vaccination status. But the most common cause of bacterial pneumonia in children is still the Streptococcus pneumoniae. All right, number 3. What are the symptoms of pneumonia in children? Most common symptoms that we see in children is coughing, fever, having trouble breathing, and also child may complain of some chest pain or might have the chills. Younger children may just seem to be irritable, but would also be showing signs of fever already. How is pneumonia diagnosed in children? Pneumonia is diagnosed by the doctor. So the doctor would ask for the baby's history and, of course, will do a full physical examination where abnormal lung findings may be seen. So just by clinically alone, the doctor can diagnose pneumonia. But in some cases, imaging studies might be helpful, such as chest x-ray. All right, number 5. Is pneumonia in children contagious? Yes, pneumonia is contagious, as pneumonia is spread by respiratory droplets. So a person who is coughing uh, and then would would pass on the respiratory droplets to another person, and then that's how pneumonia gets infected into another person. That is why it is important to practice good hand hygiene by frequent hand washing and covering one's mouth when coughing. So, what is the treatment for pneumonia in children? The treatment for pneumonia would depend on the cause. If it is a bacterial cause, then antibiotics are prescribed. And if it is a viral, well, antivirals may be given. Also, supportive measures are also important, such as plenty of rest, a lot of hydration, so giving enough liquids, and of course, to make the child more comfortable by giving medications that would reduce the fever. Can pneumonia be prevented in children? Yes, we can prevent pneumonia in children by number 1, vaccination. As to the most common cause of viral pneumonia is the flu. So a child can get a flu shot or flu vaccine to prevent influenza. And also, a child can receive vaccination against pneumococcus, which is known as the pneumococcal vaccine. And other ways to prevent pneumonia is to practice good hand hygiene, so with frequent hand washing. How long does it take for a child to recover from pneumonia? Recovery from pneumonia would depend on how severe the infection is and would also depend on the child's health status. For a previously healthy child, administering medications for 3 days, and on the third day, you would note a huge improvement on the pneumonia symptoms, and then the child may be completely recovered by a week. But for kids who have a weaker immune system, recovery may take a bit longer. Are there complications associated with pneumonia in children? Yes, pneumonia can lead to complications. If the infection is moderate or severe, it can lead to respiratory distress. Another possible complication is pleural effusion, where there is fluid around the lungs. And the worst case scenario is respiratory failure, where the child may need extra measures to help with breathing. All right, when should I seek medical attention for a child with pneumonia symptoms? So it is important that you monitor your child. You should let your doctor know or bring the child to the ER if the child is having trouble breathing, if your child has persistent high fever, and if you think your child has worsening symptoms or the cough has been worsening, or if the child now appears dehydrated, where the child is weak looking, has sunken eyes, and have fewer wet diapers. It is important that you bring your child to the doctor immediately. And for a bonus, what should parents do at home when the child has pneumonia? All right, there are several things that you can do to help your child with pneumonia. First off is to give medications. So you can give fever reducing medications to make your child more comfortable. Also, if your child has been prescribed with antibiotics, make sure to give it at the correct timing and to give the full course. If your child has been prescribed with 1 week antibiotics, it is important you complete the 1 week. All right, next tip for you is to give your child plenty of rest. Ensure that your child has adequate sleep in order to recover. Next is to make sure that your child is hydrated. So you can give plenty of fluids, you can give soup or clear broths, and electrolyte solutions. This would prevent dehydration. Another thing that you can do is humidification. So you can use a humidifier to make your child's room more comfortable, to add moisture so that your child would would not have a hard time coughing and breathing. And another thing you can do is to give your child comfort measures. Um, do warm compress, give fever reducing medications as well. Another thing you can do is to monitor your child. Keep a close eye and to check if the symptoms are worsening, or check your child's hydration status, check if your child has a fever. And last, isolation. As pneumonia is contagious, it is important that you isolate your sick child from other members of the household, especially those who have weaker immune system. Hey, if you like this episode, watch my next video where I teach you about other child health problems.